Hi students, good evening and welcome to this series on Professional Exams Made Easy. This series or these video lectures have been made keeping in mind the upcoming first MBBS university exam. These may happen in the month of August or September. We wanted to discuss some of the most important topics and how to approach your theory exams in these series. So let's get started. And in the first video of this series, we will discuss about the most frequently asked topics of the head and neck and also what should be the approach. So let's get started. Before we get into what should be our approach when we take up the first MBBS anatomy exam, what are the most frequently asked topics from the topic of head and neck? Let's try to understand. As we know, in the entire anatomy, especially gross anatomy, the head and neck, then abdomen takes the chunk of the marks, right? In some of the universities, this is asked in paper 1 and some it is asked in paper 2. But usually the head and neck alone can contribute to up to 30% of the marks in that paper, including both descriptive questions as well as MCQ questions. So what are the most frequently asked topics from head and neck region? First, let's try to understand. If you go through previous year question papers, which is the first step towards writing the first MBBS university exam, you should collect as many question papers as possible in your own university. And my suggestion is, since all of you belong to CBME batch, try to collect all the question papers after 2019. Okay, segregate it as paper 1, paper 2 and try to analyze which topics have been asked most frequently. And if you analyze especially the head and neck region, you will see that majority of the question come from the topic of the tongue. This is like the favorite topic of all the paper setters. Tongue. Then dural venous sinuses and the cavernous sinus in particular. Classify dural venous sinuses, describe cavernous sinus in detail. This is what the question will look like. Then parotid gland, I believe, is one question that is asked almost in every alternate exam, in every university that you see, right? The external features or relations of the parotid gland along with the structures present inside it. And then the most important thing is the secretomotor innervation of the parotid, which is very frequently asked, right? Then the extraocular muscles. How do we classify? What are the attachments? What is the innervation? And what about the actions of these muscles, right? Then what about muscles of mastication? How do we classify muscles of mastication? What are the attachments? What about their innervation and actions? In the region of the infratemporal fossa, one more topic that is very frequently asked is the temporomandibular joint, right? Then the anatomy of the thyroid gland, anatomy of the soft palate, right? Apart from these, there are questions on the intrinsic muscles of the larynx, right? Then the carotid triangle, one of the part of anterior triangle of the neck, the posterior triangle of the neck, anatomy of the scalp. If you analyze the question papers of majority of the universities, these are the topics that have been asked most frequently, right? So these are the topics that you must be prepared thoroughly with. Now, with this brief introduction to the most important topics in the head and neck region, let's see few questions which are asked in different universities. This is the first question that we have. Let's take time to read this question. Whenever you enter your exam hall, please don't get scared by the length of the question. If it is a case-based question, all you need to do is you need to keep a calm head, right? Because they will not ask you about the medicine part or the surgery part of any topic. They will ask you only the anatomy. So if a long case is given, please don't get frightened. Read the question carefully In the end, the question will be on anatomy only. For example, let's see this question. A male patient was brought to emergency department with head injury following a road traffic accident. Now, on examination, he was found to have black eye, scalp, pulsating exophthalmos. Now, this is interesting. Pulsating exophthalmos is seen in keratico-cavernous fistula. So, black eye is seen in the injuries of the scalp or head injuries, right? So, a patient presents to emergency with black eye and pulsating exophthalmos. On radiological examination, the fracture of body of the sphenoid was noted. Let's read the questions now. What is the anatomical basis of black eye, right? And then pulsating exophthalmos in this patient. So remember, the first part of the question is trying to ask about what is the anatomical basis for black eye and pulsating exophthalmos. The second question is name the dural venous sinus that is likely to be involved, describe its relation, tributaries, communication, and then classify dural venous sinuses. The first thing you need to do is take a look at the marks distribution. For anatomical basis of black eye and pulsating exophthalmos, there is 1 marks allotted each, right? So try to answer according to the allotted marks. The next thing is we need to name the dural venous sinus that is affected and then describe its relation, tributaries, and communication, right? 6 marks are allotted to this, and you need to spend most of the time describing the relations, tributaries, and communication of this dural venous sinus. And then the last 2 marks are allotted for classified dural venous sinus. Whenever there is a question on classification, use a simple flow chart. Try to describe the answer. Now, what is the anatomical basis? Let's try to split up this question. What is the anatomical basis for black eye? The anatomical basis for black eye is any head injury or any injuries of the scalp can lead to accumulation of blood in the 4th layer of the scalp. And this blood can seep into the eyelids. How? This is because absence of the bony attachment of frontal belly of occipitofrontalis. Now, this is the only key sentence the examiner would look for. What is it? Absence of the bony attachment of frontal belly of the occipitofrontalis. This helps in seepage of the fluid or the blood into the skin around the eyelid, resulting in black eye. Right? As I said, once you write this sentence, try to highlight it. Okay? Either put it in inverted commas or underline it. Right? This is to ensure that the examiner catches the answer that you have written. Right? Remember, the golden rule in any exam is make sure that the examiner reads the key points. Remember, any examiner who would evaluate your paper would spend anywhere between 4 to 6 minutes evaluating your paper, sometimes even less than this. And imagine in these 4 to 8 minutes, you need to convince the examiner that you have written the most important and the key points in your answer paper. How do you do it? Ensure that it is highlighted. Right? This is why we say if you are low on content, your presentation can actually compensate for it. Give me a minute. Yeah. So your presentation can compensate for it. Right? So this is how you should approach answering the question. Now, the second part of the question, why the pulsating exophthalmos is due to. Pulsating exophthalmos in one sentence is due to keratico-cavernous fistula. So what happens here is the abnormal communication between the internal carotid artery and cavernous sinus gets established. Why? Because of cavernous sinus thrombosis. So what? The blood from the carotid artery enters the cavernous sinus. From the cavernous sinus through the ophthalmic veins, it goes into the eyeball and pushes it out. So every time the heart beats or systole occurs, the eyeball pops out because of this communication between the veins of the eye and the cavernous sinus. Now, why the cavernous sinus is pushing the blood? Because it has an abnormal communication with internal carotid artery. Right? This is how you should explain the anatomical basis. As far as possible, try to use flowcharts while describing or explaining such anatomical basis. Right? Fine. The next question is pretty straightforward. You need to describe the relations of the cavernous sinus, and we know whenever we describe the relations of the cavernous sinus, we describe it in terms of internal relation and external relation. In external relation, we write all about the temporal lobe, the pituitary gland, all the structures related to it. In internal relations, we'll talk about the structures which are present in the lateral wall and in the center. Right? And the last, of course, is classification. And remember, whenever you want to classify using a flowchart like paired and unpaired. So whenever there is classification, please use a flowchart so that it becomes easier for the examiner to read. This is how you should be approaching answering to a specific question. Right? Done. Now, we are not discussing about the upper limb questions, but in one of the universities, if you observe, the question was direct. So this was a case-based question, but in one more university, which is like one of the largest university in the country, the question was pretty direct. Classify dural venous sinus, then describe in detail the cavernous sinus under following headings. Where is it located and what is the extent? What are the relations? What about the tributaries? And what about the applied anatomy? Remember, in this question paper, the marks distribution was not given. Now, this makes the answering of the question a little bit tricky, right? So you need to carefully decide how much to spend on each part of the question. Remember, for me, the thumb rule is never spend more than 25 minutes. Never ever spend more than 25 minutes on answering a long essay question. If it is 10 mark, 25 minutes. If it is 15 mark, maybe 10 minutes more, but not beyond this. Remember, if you have written an answer for 25 minutes, believe me, you will get at least 7 or 8, provided you have written the content, right? So even if you write 5 minutes, 10 minutes extra, you might get half marks, 1 marks more, which is not worth doing considering the number of questions you need to answer with respect to your 5 markers, 3 markers or 1 marker, right? So remember, never use more than 25 minutes for long essay. Now in this, classify dural venous sinus again using a flowchart. Then location and extent, you can be very brief, right? Where the examiner would give more marks is to the relations of the cavernous sinus, and this should be substantiated with the diagram. Now, again, the thumb rule in writing the diagram is write the diagram wherever is it necessary, right? Some of our seniors would come to us and tell that, okay, if there are 48 pages in your answer book, which is the number of answer pages in most of the university answer booklets, you write 1 diagram per page, the examiner will give 1 mark per page. Please don't fall for this trap. This never happens, right? The examiners also know the subject, right? The examiner will not simply give you a mark if you have written 1 diagram per page and the diagram is absolutely not necessary for that question. So write relevant diagrams only. Even if you write 2 or 3 diagrams for a long essay, that is enough. But those should be the relevant ones. And don't think that the examiner is actually looking for artistic diagrams. None of us, or not all of us, are blessed with the ability to draw good diagrams. What the examiner expects in exam is correct diagram. The diagram should be anatomically correct. That's it. Okay. We cannot draw artistic diagrams. Fine. So draw diagrams if it is absolutely necessary, right? Don't fall for the trap of writing more number of diagrams thinking that for every diagram you will get 1 mark. That is absolutely false, right? Done. So this is how you should approach the question, right? So some of these will be case based and some of these will be direct. Most often, the one question that scares you is the case-based question. But as I said, all you need to do is spend little time, read the question paper calmly, try to understand the question and then answer. Whenever you see a case-based question, the thumb rule is don't panic. Keep calm, read the question thoroughly and then answer it. Right? Done. Now let's see a few more questions which were asked in the topic of head and neck. This was one more question from one of the largest university in the country, right? And the question, let's try to read. Again, a case-based question. A 10-year-old girl underwent bilateral tonsillectomy for chronic tonsillitis. On examination prior to discharge, the surgeon noted an absence of touch sensation on posterior one-third of the tongue. As soon as you are reading this, you know that this is about the glossopharyngeal nerve. But don't jump into conclusion. Read the question carefully. Remember, one mistake most of the students do is once they read one or two lines of the question, they jump into conclusion that this is the question that is being asked and start answering it, which is not correct always. Take your time, read the question carefully, try to understand what is this question about and then answer it. So let's read the next part. Along with an absent gag reflex. Absent gag reflex is also pointing towards the injury or paralysis of glossopharyngeal nerve. One more nerve that could be involved here is vagus nerve because gag reflex is associated with both glossopharyngeal and vagus nerve. Then, based on your knowledge of anatomy, answer the following question. Right? So they have given a case description. Now they are asking, based on your knowledge of anatomy, try to answer the following question. Now let's see if the question is related to glossopharyngeal nerve or something else. First, name the nerve damaged during surgery. Bilateral tonsillectomy, absence of touch sensation from posterior one-third of the tongue, absence of gag reflex. All this point toward which nerve? The ninth cranial nerve or the glossopharyngeal nerve. Then, what are the external features of posterior one-third of the tongue? See, there was only one question for 1 mark on glossopharyngeal nerve. So if you had started writing glossopharyngeal nerve throughout, not reading all the questions, you would be at loss. So for writing glossopharyngeal nerve, you will get only 1 mark. You will not get anything else if you try to describe glossopharyngeal nerve in detail. Read the next questions. What are the external features of posterior one-third of the tongue, which carries 2 marks? Then, development of the tongue and correlated with nerve supply, 4 marks. So for development and nerve supply correlation, 4 marks. Then histology of the tonsil, 3 mark. Right? This is why I said, whenever you see a question and you have a clue about what the question is leading to, please don't jump into answering that question. Please take your time and then read the question carefully and then answer. Right? Done. This is a question in which the examiner is asking you about the glossopharyngeal nerve based on your knowledge of whether you know the nerve supply of the tongue and the afferent limb or the gag reflex. The examiner is also asking you about the features of the posterior one-third of the tongue. The examiner is also asking you about development of the tongue and its correlation to nerve supply. He's also asking about histology of palatine tonsil. So in one question, he's checking neuro, gross anatomy, histology, embryology, everything. These sort of questions you can expect more in your exam. Right? This is how the CBME question paper after batch 2019 will look like. Let's try to read one more question, which was again asked in one of the largest university of the country. A 65-year-old man who was a chronic smoker and tobacco chewer for past 15 years came to hospital with ulcerated lesion on anterior part of the tongue. Okay, so it is leading to tongue, which bleeds on touch. He was unable to swallow. Foul smell was emitting from his mouth. Okay, on examination, he had enlarged submandibular and lower cervical lymph nodes. Okay, these are the nodes which drain the lymph from the tongue. He was diagnosed with carcinoma of the tongue. So that explains the enlargement of the lymph nodes which drain the tongue. Right. The diagnosis has already been given. The patient is having carcinoma of the tongue. Now let's read the question. Based on the anatomical knowledge, what are the external features of the tongue? So remember, the examiner is directly going to the external features of the tongue, and this has been allotted 3 marks. So this is where we divide the tongue into various parts, start describing its features. Next, name the muscles of the tongue. So remember, what he says is name. When the verb that is used is name, please stick to naming the muscles. If it is describe, if it is explain, then go on describing the attachments. So what he has said, name the muscles of the tongue with their nerve supply. All we need to do is name all the extrinsic muscles, all the intrinsic muscles, and write its nerve supply. Please don't waste your time describing the attachments. If the question is describe the attachments or explain the attachments, then only you should do it. Otherwise, no. Right? Done. Then describe the blood supply and lymphatic drainage of the tongue. Again, this is for 4 mark. Then development of the tongue, 4 mark. Right? So this is how the question will be framed. Even if it's a case-based question, if you see the question, it is based on anatomy only, nothing else. Right? This is why I keep saying, please read the question carefully. Right? Most of the universities, like when the exam starts, you will get at least couple of minutes to read the question paper entirely. Take your time, read the entire question paper thoroughly, decide on which section you want to attend first, then start calmly. Right? The most important thing you need to keep in mind when you answer your theory question paper, keep your calm. Right? Done. Now, as we have seen, one of the most frequently asked topic in the exam is anatomy of the tongue. We will not be able to discuss all the 12 topics in one single session, but as we just saw, in most of the universities of the country, one question that often gets repeated is the anatomy of the tongue. We'll try to discuss it. The other topics are also important, right? But if anatomy of the tongue is asked and you don't have specific headings, how do we approach it? Let's try to understand, right? So whenever a question is asked, most of us teachers are obsessed with this definition. Try to start with it. Now, what is tongue? Tongue is defined as a mobile, muscular organ situated partly in the oral cavity and partly in the pharyngeal cavity. So, tongue is a conical muscular organ situated partly in oral cavity and partly in pharyngeal cavity. This is how we define the tongue. Then, what are the external features? Remember, the tongue has got a root by which it is attached to the floor of the mouth. Then it has got a tip, right? The tip is the most anterior part of the tongue, whereas the root is the part of the tongue that attaches the tongue to the floor of the mouth. Then, what about the body? Remember, the body of the tongue is further divided into 2 surfaces, right? Now, what are these surfaces? We have the dorsal surface and ventral surface. Wherever possible, try to write like this, not one below the other, so that the examiner gets a clear understanding. Then, it has got 2 margins, right? Now, what are the margins? The margins are lateral margins, right? Done. So this is how you should describe. So once you have listed the external features, then go on describing. For example, briefly describe what is root. Root is part of the tongue by which it is attached to floor of the mouth. Tip of the tongue is the most anterior part of the tongue, right? Then the next thing is to describe the features of the body. As we just learned, the body is divided into a ventral surface and a dorsal surface. First, start with the dorsal surface. In your exam, most often they will ask you the features of dorsal surface. Right. The dorsal surface of the tongue is first divided into 2 parts. These are the anterior 2/3 and posterior 1/3. Now, what divides the tongue into anterior 2/3 and posterior 1/3? this is this V-shaped sulcus. What is this sulcus? This is the sulcus terminalis. Right? So circle terminalis divides the tongue, the dorsal surface of the tongue into anterior 2/3 and posterior 1/3. What are the features we need to identify in the anterior 2/3? Right? So if we talk about anterior 2/3 of the tongue, the anterior 2/3 of the tongue will have structure called as lingual papilla. Right? Now, what are lingual papilla? These are projections coming from the mucous membrane of the tongue. And these could be of the 4 types. One is the circumvallate type. Then we have folate, right? Then we have the fungiform, right? We have fungiform. And finally, we have filiform. Now, try to show the papillae in the diagram first. Okay. So this is the circumvallate papilla. This is the folate papilla. Then these are the fungiform papilla. And the most numerous, these are filiform papilla. Right. So label it in the diagram and now try to describe it. Now, how will you describe each of these papilla? My suggestion, for each of the papilla, what we need to do is, we can describe under the headings of location, right? Then what is the shape? Then the presence or absence of taste buds, and we can end it with nerve supply, right? So imagine if you write for each of these papilla under these 4 headings, how your answer looks. For example, where is circumvallate papilla located? Circumvallate papilla are one of the largest lingual papilla located in front of sulcus terminalis. Right? Then what about shape? These have a moat, and within that they have a papilla with a large apex and narrow base. So this is regarding morphology. Then what about taste buds? Taste buds are present in plenty in case of circumvallate papilla. Then how about nerve supply? These are supplied by the glossopharyngeal nerve. Even though they are present in the anterior 2/3 of the tongue, the taste sensation from the circumvallate papilla is carried by glossopharyngeal nerve. Try and do the same for rest of the papilla. If you can make a table, that is the best way of answering, right? So you have papilla on one side, you have 4 columns, location, then morphology, then presence or absence of taste buds, and then you talk about the nerve supply, right? Now, how we can do this? So let's try to understand. Imagine we are putting a simple table, right, where we are discussing features, and then this is circumvallate papilla, then folate papilla, then the other 2 papilla we can talk. Then here we can have location, then the morphology, taste buds, nerve supply. So imagine if you write your answer like this, will it make it easier for your examiner to read it? This is what you should do. Thumb rule, always try to impress your evaluator so that you get maximum marks for that question. This is how you describe the features of the anterior 2/3. How will you describe the features of the posterior 1/3? In the posterior 1/3, we have only one feature. And what is it? These are lingual tonsils, right? Now, what you will write for lingual tonsil? Now, define what are lingual tonsil, right? Then describe little bit about the Waldeyr's ring, how the Waldeyr's ring is formed. So lingual tonsils are submucosal aggregation of lymphoid tissue found on the surface of the tongue. These form an important part of the Waldeyr's ring, right? anteriorly lingual tonsil, laterally we have palatine tonsil, tubal tonsil, and most posteriorly we have nasopharyngeal tonsil. This is how you must describe the features of the dorsal surface. And once you've described it, if asked, ventral surface, right? If they have just asked describe the features of the tongue, you have to write the ventral surface, because this is often forgotten by the students to write. Okay? You don't have to write a separate diagram for this. What are the structures you will show in the ventral surface of the tongue? The first structure, what is it? This is the frenulum of the tongue. Now, what is frenulum of the tongue? Frenulum of the tongue is a mucous membrane which attaches the tongue to the floor of the mouth. Then, on either side, we see the lingual veins present within a fold called as plica fimbriata. Right? So this is how your answer should be. So be brief about ventral surface, because there is nothing much to describe. Then, once this is done, the next important subtopic they will ask you is about the muscles. Now, we know that the muscles of the tongue can be grouped as two. One is the extrinsic muscles and the other one is the intrinsic muscles. And as I have said, whenever you need to classify, use a simple flowchart like this. Now, what are the extrinsic muscles? These are the muscles which move the tongue. What are intrinsic muscles? These change shape of the tongue. Right? They are responsible for changing the shape of the tongue. What are the extrinsic muscles we have? We have the genioglossus. So can you tell me about other muscles? Yes, one is styloglossus, right? So we have the styloglossus. Then we have the palatoglossus, right? Then the last muscle we have is the hyoglossus, right? So write the names of these muscles completely. Please don't use abbreviation. Examiners absolutely hate when you write abbreviations. You may simply lose marks. Now, what are intrinsic muscles? Remember, superior longitudinalis, inferior longitudinalis. I'm writing the abbreviation, but I'm warning you again. Please never use abbreviation in your exam. Then we have verticalis linguae and the verticalis linguae, and other one is transversalis linguae. So these are the muscles, how we classify. Now you need to describe these muscles in detail. For example, first start with the extrinsic muscles of the tongue. And for all the extrinsic muscles, you should talk about origin, right? Then you should talk about the insertion. Then you need to talk about the nerve supply. And finally, you need to talk about the action, right? Now, the first and the most important muscle we have is, let's say, genioglossus. The genioglossus will take its origin from the superior genial tubercle, gets inserted to side of the tongue. The second muscle you see here is hyoglossus, takes its origin from the hyoid bone, gets inserted to side of the tongue. The third muscle we have here is styloglossus, comes from the styloid process, gets attached to side of the tongue. The muscle which is not shown here is palatoglossus, which comes from palatine aponeurosis, gets inserted to the side of the tongue. This is how you describe the attachments. Done? Then, what about nerve supply? We will learn that nerve supply to all the muscles of the tongue is by hypoglossal nerve, except for palatoglossus, which is innervated by the cranial root of axillary. Actions. You need to be very specific about the actions. For example, genioglossus is called as the safety muscle of the tongue, right? Now, you need to describe why it is called as safety muscle of the tongue. The examiner will expect you to explain this. Genioglossus, remember, helps in protrusion of the tongue. Whenever genioglossus contracts, it protrudes the tongue. That is why we call it as safety muscle of the tongue. What about styloglossus? Since styloglossus is attached to the styloid process and then attached to the side of the tongue, this causes elevation of the tongue, right? What about hyoglossus? Hyoglossus comes from a bone below and attached to the side. So this depresses the sides of the mandible. What about palatoglossus? Palatoglossus again comes from above, attached to the side of the tongue. This also elevates the side of the tongue. This is how you should remember the action, and this is how you must write it. Again, how would you describe the muscles, attachment, innervation? Again, make a simple table. So here talk about features, right? So first the origin, then insertion, then nerve supply, and then action, right? And then start writing about genioglossus, hyoglossus, then palatoglossus, and the styloglossus, right? Imagine if you write like this, it becomes easier for the examiner to read your answer again, right? Whenever possible, whenever you are asked to describe multiple muscles, please use this tabular column format so that you will score the maximum, right? Once you write a table, tabulating any structure is one of the highest forms of gaining knowledge, right? And this is one best way of writing your answer. Then what about intrinsic muscles? Remember, intrinsic muscles we have 4: superior longitudinalis, inferior longitudinalis, then transversalis linguae, and verticalis linguae. You don't need to write fancy diagrams to explain this. So simply draw the outline of the tongue. So let's imagine this is the outline of the tongue as seen from the sagittal section, and we can write one more diagram like this to show one important muscle. Now, the first muscle, let's say we show is the superior longitudinalis, which extends from the tip to the posterior part of the tongue. Similarly, there is inferior longitudinalis, right, which extends again from the tip to the posterior part. Then there is a muscle called as verticalis linguae, which runs through the substance of the tongue from the dorsal surface to the ventral surface. So what is this? This is not the transversalis linguae, this is the verticalis linguae. How the transversalis linguae is present? It extends between the two margins, the two lateral margins of the tongue. In case of longitudinal muscles or transverse muscles, any of the intrinsic muscles, they don't expect you to write attachments exactly. This is what you can write, right? But what they expect you to write is actions of these muscles. For example, superior longitudinalis, inferior longitudinalis will shorten the tongue. They will reduce the length of the tongue. Transversalis linguae will make the tongue narrower, right? Verticalis linguae will make the tongue thinner. So whenever the muscle contracts, what exactly happens, we need to mention, right? This is regarding how we describe intrinsic muscles. Remember, again, all intrinsic muscles are innervated by which cranial nerve? It is the hypoglossal nerve, right? This is regarding the intrinsic muscles. Once we have written it, the next thing is regarding arterial supply. Now don't waste time writing the diagram to show the arterial supply. Simply write the arteries of the tongue are derived from the lingual artery, which is the principal artery. Then it is supplied by the tonsillar branch of facial artery, right? This is the second artery. And the third artery we have is the ascending pharyngeal artery. So just go on listing the names of the arteries. No need to describe it in detail. Then what about the veins? Veins, remember, the most important vein we have is the deep lingual vein, right? Now this is again the principal vein of the tongue. Deep lingual vein, where does it drain? It drains into the internal jugular vein. Then we have the venae comitans, right? We have venae comitantous, two venae comitantous, right? So one which follows the lingual artery, but one which follows the hypoglossal nerve. Some of your examiners may be interested in this, the vena comitantes, which go along with hypoglossal nerve, because this is the only nerve which has accompanying veins. Everywhere arteries are accompanied by veins, right? This is one peculiar region of the body where a nerve is accompanied by a vein. This is more likely to be a viva question for you in your gross anatomy practicals rather than in theory. Right? Done. This is regarding the venous drainage. Once we have learned this, let's talk about lymphatic drainage of all the subtopics of the tongue. This could be one topic which can be asked as a short note or a 5 marker. Now, how do we describe the tongue? Lymphatic drainage. The lymphatics of the tongue are divided into the apical vessels, right? Then we have the marginal vessels, right? Then we have central vessels, right? And then we have the basal vessels. Now this is a diagram that you need to write. Okay, let's mark. These are submental lymph nodes. These are submandibular lymph nodes, right? This muscle that we have here, okay, this is the digastric muscle. So this is jugulodigastric. These are deep cervical nodes, and this is homohyoid. So this is jugulo-homohyoid node, right? Now, what is this blood vessel? This is internal jugular vein. The apical vessels drain the tip of the tongue, right? And where do they drain? They drain into submental lymph nodes, right? So the lymph from the tip goes here, and from here the efferents will reach the submandibular lymph node, right? So submental to submandibular, right? What about marginal? Now, when we talk about marginal vessels, where do the marginal vessels drain? These drain mainly into submandibular nodes, and from the submandibular nodes, these drain into the jugulo-homohyoid node. This is what you need to write. So what does marginal vessels drain? The margins of the tongue, which goes to submandibular nodes, and from here they go to jugulo-homohyoid nodes. This is how you should write. Then, what about the central vessels? Remember, the central vessels mainly drain the entire anterior 2/3 of the tongue, right? So this entire area will drain into the deep cervical nodes. So central vessels, where do they drain? These drain the anterior 2/3, and where do they go? They go to deep cervical nodes, right? The last group. What about the last group? The last group is the basal region, which is posterior 1/3 of the tongue, and this also drain into the deep cervical nodes or jugulo-homohyoid nodes. So they drain the posterior 1/3, and they drain into deep cervical and jugulo-homohyoid node. So what we have here, most of the lymphatics ultimately go where? The jugulo-homohyoid nodes. So the principal node of the tongue, right? So when we talk about principal node of the tongue, which is the principal node? Remember, it is the jugulo-homohyoid node, right? Maybe you can highlight this, right? So jugulo-homohyoid is the principal node of the tongue. Done? This is how we can explain the lymphatic drainage. But remember, lymphatic drainage is often asked as a 5 marker. Now, what is the clinical importance? Remember, in posterior 1/3, right? In posterior 1/3, the lymphatics decussate freely. The lymphatics decussate with opposite side, right? And because of this, metastasis, it is more, and carcinoma of posterior 1/3 usually has poor prognosis, right? Anterior 2/3 of the tongue, the lymphatics, they do not cross, but in the posterior 1/3, the lymphatics freely cross across midline. This could be one of the factors which will favor the spread of carcinoma, right? This is regarding lymphatic drainage. This is how you should describe it. Let's see the next part, the development. Again, this could be a separate 5-marker question, development of the tongue. If development of the tongue is asked, please try to describe it under these settings. Remember, most of the students jump into writing about lingual swellings, tuberculum impar, hypobronchial eminence. But first, try to describe the muscles of the tongue using these headings. Okay? Remember, the muscles of the tongue develop from occipital myotomes, right? They develop from occipital myotomes. The connective tissue develops from the mesoderm. Get these two out of the way and then talk about development of the mucous membrane. This is the diagram we need to write. So here we have the first pharyngeal arch, the second, the third, we have the fourth, and let's say we have the sixth here, right? The first pharyngeal arch. So we are describing the development of the mucous membrane, and the first pharyngeal arch gives rise to two swellings called as lingual swellings, right? And then a median swelling called as tuberculum impar, right? This is called as tuberculum impar. Then arising from the second, third and fourth arch, we have this elevation called as hypobronchial eminence, right? So this hypobronchial eminence, right? This gives rise to the posterior part of the tongue. Now what we need to do is we need to summarize how the anterior 2/3, posterior 1/3, posterior most part of the tongue comes. The anterior 2/3 of the tongue, remember, comes from the lingual swellings, right? The lingual swellings plus the tuberculum impar, right? What about posterior 1/3? Posterior 1/3, the cranial part of, right? It comes from cranial part of the hypobronchial, right? It comes from hypobronchial eminence. Done? What about posterior most part? This comes from the caudal part of hypobronchial eminence. This is all you need to write. So a diagram, the subheadings of development of the tongue as the development of the muscles, development of the connective tissue, development of the mucous membrane. Is this clear? This is how we do it. Now, the next important part in the development of the, in the anatomy of the tongue is its nerve supply. How do we describe the nerve supply of the tongue? This is how we do it, right? We classify it into motor, sensory. The motor nerve supply of the tongue, we need to write one single sentence. All muscles of the tongue are innervated by which cranial nerve? The hypoglossal nerve, except a muscle called as palatoglossus, which is innervated by the cranial root of accessory nerve, right? In one single sentence, this is how we describe the motor nerve supply. Whenever nerve supply is asked, we often forget to mention about the motor innervation. Please ensure that the motor innervation is written properly. Then, what about sensory nerve supply? Sensory nerve supply is divided into general sense and special sense. What do we mean by general sense? General sense refers to touch, pain, temperature, right? All these sensations from the tongue is referred to as general. Special sense in simple refers to taste, right? Nerve supply of the tongue is one more question which can be asked as a separate 5-marker. right? And usually they'll ask you to correlate it with the development. We will see how to correlate, right? So first, let's talk about how the general sense from the tongue is carried. From the anterior two-thirds of the tongue, the general sensation is carried by a nerve called as lingual nerve, right? Whereas from the posterior one-third, it is the glossopharyngeal nerve, and from the posterior most part, it is the internal laryngeal nerve. Remember, this is a branch of the vagus nerve. So touch, pain and temperature from anterior two-thirds of the tongue is carried by anterior two-third lingual nerve, posterior one-third glossopharyngeal nerve, posterior most part, it is the internal laryngeal branch of vagus. Now in anterior, when we talk about taste sensation, the anterior two-third is innervated by a nerve called as chorda tympani, which is a branch of the facial nerve. So taste sensation from anterior two-third is carried by chorda tympani. Posterior one-third, it is again the glossopharyngeal nerve, right? Posterior most part, what do we have? We have the internal laryngeal nerve, right? And remember, this is a branch of which nerve? Vagus. So if you observe, posterior one-third and posterior most part of the tongue, nerve that carries general sensation and nerve that carries taste sensation is the same. From the posterior one-third of the tongue, general sense and taste sense is carried by glossopharyngeal nerve. From the posterior most part of the tongue, general sense and taste sensation is carried by internal laryngeal branch of vagus, right? This is regarding the innervation with respect to posterior one-third and posterior most part. In the anterior two-third, only the nerve differs. General sense, lingual nerve; special sense, the facial nerve, chorda tympani. Once you write all this, I want you to write one more important sentence. Circumvallate papilla, even though they are present in anterior two-third, the taste sensation is carried by glossopharyngeal nerve. In spite they are present in anterior two-third, chorda tympani will never carry the taste sensation, whereas the taste sensation is carried by the glossopharyngeal nerve. Now, what is the embryological basis for this? Remember, the circumvallate papilla is developed from the third pharyngeal arch, and hence it is supplied by the nerve of the third pharyngeal arch, which is the glossopharyngeal nerve. Right? Now, how do we embryologically correlate the nerve supply? Remember, the muscles of the tongue are supplied by hypoglossal nerve. The muscles of the tongue develop from occipital myotomes or somites. Hypoglossal nerve is the nerve of the occipital somites. The anterior two-thirds of the tongue mainly come from lingual swelling and tuberculum impar, which comes from which arch? The first arch, right? That is why it is supplied by lingual nerve. It is a branch of mandibular nerve. Mandibular nerve is the nerve of the first arch, right? What about posterior one-third? The cranial part of the hypobronchial eminence mainly comes from the third arch. That is why it is innervated by glossopharyngeal nerve. The caudal part of the hypobronchial eminence, which gives rise to posterior most part of the tongue, mainly comes from the fourth arch, and hence it is supplied by the internal laryngeal nerve, internal laryngeal branch of vagus. This is how we correlate the nerve supply of the tongue embryologically with its development, right? As I said, development of the tongue, lymphatic drainage of the tongue, nerve supply of the tongue. These are three separate short essays that you can expect in the chapter of tongue. Done? So this is how you should go on describing the anatomy of the tongue. Done? Now what we have done today is, we have discussed only one topic that is asked as a most frequent long essay in the topic of head and neck, right? There are plenty of topics, right? And we cannot go on discussing all the topics in one single session. Please do let me know if you want me to discuss any of the other topic that you feel is difficult in the head and neck region. we shall take the topic and discuss in the next week. Otherwise, we have got a schedule for the next 9 weeks. This is the first episode of the 10-week series of this Prof Exam Made Easy. In the next session, we have the neuroanatomy discussion. We will discuss some of the most important topics asked in neuro. Then comes the topic of thorax, upper limb, lower limb, abdomen, pelvis. Last 3 sessions we have kept for 3 questions or 3 topics which are not very frequently studied by the students: histology, embryology, and general anatomy. This is how we have planned our session. Now, in the next week, if you want me to discuss any particular topic in neuroanatomy, please do message in so that I will take up that topic and we will discuss the topic in detail, right? Similar to that, whatever topic you want me to discuss in each of the regions, please message in the chat box and I shall take up the topic when we talk about the particular region. This is regarding some of the most important topics asked in the head and neck region and how should be your approach. As we progress each week, I will tell you the tips and tricks to excel in your theory exam, right? With this, let's close the session. Thank you for being here and all the best for your preparation.